Are there dietary restrictions with Azilect? Let's dive into the question of whether there are dietary restrictions when taking Azilect, also known as rasagiline. This medication is used to treat Parkinson's disease and works as a monoamine oxidase B inhibitor. One of the main concerns with this type of medication involves tyramine, a compound found in certain foods. Tyramine can interact with monoamine oxidase inhibitors and lead to a hypertensive crisis, which is a sudden and dangerous increase in blood pressure. However, recent clinical guidelines suggest that if you take Azilect at the recommended dose of 1 milligram once daily, you typically do not need to follow strict dietary restrictions regarding tyramine. This is because Azilect selectively inhibits monoamine oxidase B at this dosage, which poses a lower risk of tyramine-related issues compared to non-selective monoamine oxidase inhibitors. That said, it is still wise to exercise caution. While you may not need to avoid tyramine completely, it is advisable to limit your intake of tyramine-rich foods, especially if you are taking higher doses or combining Azilect with other medications that affect monoamine oxidase activity. Foods that are high in tyramine include aged cheeses, air-dried or fermented meats like salami and sausages, spoiled or improperly stored animal products, certain beers, broad bean pods, pickled herring, red wine, sauerkraut, soy products like soy sauce and tofu, and yeast extracts. Eating large amounts of these foods while on Azilect could potentially lead to a dangerous increase in blood pressure. And if you experience symptoms like severe headache or palpitations, it is crucial to seek medical attention immediately. In summary, while strict dietary restrictions are not necessary when taking Azilect at recommended doses, it is still prudent to avoid excessive consumption of high tyramine foods. Always follow your healthcare provider's advice and report any unusual symptoms you may experience. Azilect can be taken with or without food, so there are no additional specific dietary limitations beyond those related to tyramine. This balanced approach aligns with current medical consensus and helps ensure the safe use of Azilect in managing the symptoms of Parkinson's disease. Remember, personalized advice from your healthcare professional is essential for the best treatment outcomes.